Welcome to The Ultimate Asset, the podcast where elite physicians, health strategists, and high-performing leaders explore what it really takes to protect and elevate your most valuable assets, your body and your mind. This is high-performance medicine, powered by Velocity Health. Hello, and welcome to another episode of The Ultimate Asset. We have a cool little mini episode today where Brock and I are going to talk about something interesting, which is sprinting and VO2 Max. Brock, we had a cool opportunity to get after it when we were in Colorado together. You damn near killed me with the altitude and the sprints, but welcome again. Hi.
Yo, we're here. Back in altitude.
Yes, we are. So, Brock, tell me about your sprinting exercises. What's your kind of routine nowadays?
You know, I think the best thing about sprinting to me is, from a distance perspective, I think it's just fun to be able to layer in different distances, and you can throw in like a ladder, 200, 300, 400, 500 back down. Sometimes you just do a bunch of repeats of shorter distances, like 100 meters, 200 meters. And then sometimes you can extend those out to like the real death zone, 400 meters, and you feel like you're going to die. So that's like the fun thing about it. But I really like to do these ladders where I kind of build up and then go back down. And then by the time you finish that, you're usually destroyed.
Yeah, I think each distance has its own technique, its own style, and ways to perfect it. And people excel at, the 100-meter guys are often not the ones that are crushing on the 800 either. So totally different there. So lots, obviously, of benefits with VO2 Max and sprinting. So there's a lot here to get into.
I think like sprinting is an odd term to me because, I guess you could sprint on anything technically. So I always think, is this applicable on like a rower, on a bike, on a running? Like when you hear the word sprinting, I guess what comes to your mind specifically?
When I hear sprinting, I hear like 90+% of perceived effort, or 90% plus of zone heart rate. Meaning if your max heart rate is 200 to make it easy, you're at like 180 or more at that point, right? Like this is where you're all out moving. I think it's interesting to think about sprinting and the studies on sprint interval training, especially, there is a component of hypertrophy as well in sprinting, which is not what most people think about. But when you are using that kind of explosive force, it's fast twitch fibers, you are actually building muscle and releasing growth hormone as well. And so, there's a lot of different ways you can get your heart rate up to that 90+% range, but actually having some resistance as well is, I think, where we see a lot of the benefit.
Nice. Yeah. I mean, so I guess when you think about a person who wants to get into sprinting workout, like, is there an introduction to this? What is the first sprint workout you would do to recommend to a patient of yours?
Well, first of all, I think it's important to just back up and talk about why do we even suggest sprinting, right? VO2 max, as we've talked about many times, is one of the most important drivers of overall health. It is a great marker of cardiac output, respiratory function, vascular health, endothelial health, actually checking or testing how much oxygen are your mitochondria using per kilogram per minute in order to create ATP in your body. And that is an important indicator of longevity. It's one of the highest correlated metrics we have to overall longevity. So how do you drive up VO2 max? Well, a lot of us focus on this base of zone, talk about that shortly, which is 60 to 70% of your max heart rate. That really is where you need to spend most of the time. But when you think about even the term VO2 max, right? Like you have to push yourself to the max in order to push your limit of what you can achieve as well. And so we recommend at least once a week to do high intensity interval training. That can be a lot of different things for a lot of people. They're the Norwegian sprints and trials where it's like 90% heart rate for 4 minutes and then 4 minutes off. But I think you need to start with the zone 2 just baseline to begin with. Before that, there's obviously just balance and stability. I wouldn't recommend a 60-year-old who has not been in the game for a while to just start ripping 100-meter sprints. Or that, you have to
it's a hamstring waiting to snap.
Exactly. So the second thing is that exactly, which is flexibility and ensuring, the number of injuries we see, especially post 50, for people who have just pushed themselves a little bit too hard, haven't warmed up correctly, haven't stretched correctly, is it's at that age, you're out of the game for weeks and weeks and weeks. And that is so much more detrimental than any perceived benefit you might get from trying to push yourself too hard. So we always guide people to slowly layer in, but once you've got the basics down, what you said is probably the best place to start, which are some ladders, 100, 200 meter, do these a few times and build up slowly to the 400 meters and ladder back down. In 30 to 45 minutes, you're going to get an unbelievably, efficient workout that has driven your VO2 max up by measurable amounts. We have studies that show even 6 to 8 weeks of sprint interval training can push up VO2 max by up to 10%. So it doesn't take long for your body to adapt here.
Dang. Yeah. I mean, I think the physiologic adaptations, and it's almost like you could feel that because after you finish a sprint workout, it is way more of a delayed onset muscle, kind of like a fatigue off of 10 minutes than an hour of zone 2. So I definitely feel, maybe this is just like a woo thing, but it's like if I feel like I'm getting beat down, maybe the adaptations are coming a little more,
From a soreness standpoint, there's probably more acute buildup of lactate, right? Lactic acid when you're sprinting versus slow diffusion of zone 2, and your body can clear that a little bit more. So you're definitely going to feel it a little bit more, but there's so many other impacts to sprinting. It releases BDNF as well, brain-derived naturopathic factor, which is very important in our stress response, in our overall insight, in our anxiety, depression. It has all sorts of correlates to improved mental health as well. I mean, a lot of folks talk about the runner's high once you sort of bust through that 10-mile mark and whatever you're just going, right? But there's actually quite a high in endorphin rush, I think, from the sprint workouts as well. And we can measure that directly.
Totally. I 100% agree. So, I mean, with everybody talking about zone 2 constantly, you can't get away from everyone talking about zone 2. I guess, do you think people do too much zone 2 compared to throwing in some sprint work and some more interval type work and higher heart rate zone work?
I think it's hard for me to say that people do too much zone 2. I think probably not enough people do zone 4 and 5 enough, right? And there's I don't remember the stat, I'm not going to make it up, but I think it's in less than 10% of people over 30 have gone on an all-out sprint in the last year of their life, right? Just be honest. How many of you listening here have in the past year ran as fast as you possibly could? There's a point in our lives where it kind of stops, right? And so even people that are getting after it, maybe you're doing the assault bike, maybe you're doing, a plyometric hit kind of thing a couple times a week. There's definitely ways to get your heart rate there. But, sprinting up a hill, especially, there are very few workouts like that you can recreate. So I think we should absolutely focus on zone 1 and zone 2. I mean, to me, the evidence is incontrovertible that if you are going to build a solid cardio respiratory base, you need time under zone 1 and 2 as much as you can, 3+ hours a week. You still, like we said, you have to push your max at some point. If you're going to push your VO2 max, you need to do the sprinting, you need to do the high intensity. Once you're in a good routine, you're stretched and you're healthy, there's probably twice a week at least is what our recommendation would be, is to really push the high intensity. That's where we see the tipping point. Somewhere around an hour and a week is cumulatively where we'll start to see a lot.
Nice. Yeah, I think I'm always curious to think about RPE with sprinting too, and almost like you were saying that when's the last time a person full out sprinted? And I think about RPE 10 out of 10, which is basically rate of perceived exertion. So how hard you feel like you're pushing. And I don't know if people know what that feels like, because I know that 10 out of 10 is the maximum pain, for the pain scale. Anyone talk about medicine, it's do we know what 10 out of 10 feels like? And so my question for you is, should your work on a sprinting be an RPE 10 out of 10, 9 out of 10, 7 out of 10? Where should someone actually throw the effort in on something like this?
I think it's a good question. I think there's a correlate to resistance training as well. And kind of reps in reserve, right? Like, are you truly going to failure? Can you really push one more rep? It is painful when you are on your eighth squat at your body weight and you are trying to push that up. Like, that's hard. And you're going to fail some percentage of times. That's why you have to have, the fail safes. I think most people don't actually ever really push themselves to that level. And we don't, like, 10 out of 10 sprinting would be like, there is a chainsaw murderer running after you, right? Like, the kind of sprint that you probably have never done in the last few years just to kind of push yourself. Very few of us, I think, have that real underlying willpower to get ourselves to that level of intensity. I think most of us can get to like the 8 or 9. And that's honestly where I would probably recommend most of us get to as well. Like, you don't want to be going absolutely all out. Like, that's highest injury potential there. Like, if you're in competition or your life depends on it, those are the times that you need to get there. But it's just like when you're training for a marathon, right? Like, people aren't going all out every single time leading up to that. Many times marathoners are not even running the full 26 miles leading up to it, right? But you get to the moment and then your adrenaline and everything kind of push you to that next limit. So I'd say, as much as you can, you should push yourself to the absolute limit, and you're probably going to, land around an 8 or 9. If you're absolutely dialed in and you can get yourself there, then even still, on most days when you're sprinting, you're probably at an 8 or 9 RPE. Just like when you're pushing, you probably push to 1 rep in failure so that you don't hurt yourself.
Yeah, totally. I like that. Yeah, I think injury risk, the risk reward ratio definitely starts skewing when you start creeping up into these high RPE, especially for someone who's older too. I mean, speaking of that, if you're just as a takeaway from sprinting, if you're a middle-aged executive who has, let's say 3 hours per week to do aerobic type exercise, like, what's a breakdown for someone like that you would give them?
I would probably at least 2 hours of zone 2, maybe 2.5, and then a half hour to an hour of high intensity work. Again, say it's an hour, right? 2 hours of zone 2, 30 minutes of kind of high intensity where you're doing the 4-minute on, 4-minute off, the Norwegian type splits, 30 minutes of sprint interval training. It's going to be hard to beat that from a cardiorespiratory fitness program standpoint. Whatever it is that's like gets you there, right? You throw in resistance training a few times a week to that. That's a very healthy, well-rounded, balanced exercise routine.
Totally. Agreed. Yeah, I like that split. I mean, so on that, we're always trying to drive up VO2 max. So to kind of segue into that, like, let's say you've been doing all these workouts, you've been trying to boost your VO2 max. Explain to me what is involved when you want to go test a VO2 max and what we're looking for, what's a decent number, and kind of just explain some of the stuff around VO2 max.
Yeah, we alluded to it a little earlier on what it's actually measuring, but, for those that don't know, who've seen these athletes with a mask on their face running on a treadmill or on a bike, that's the VO2 max. It's typically done in a lab. There are sort of poor man's way of doing it. One's called the Cooper test. You can kind of just run all out for 12 minutes. And then another one is kind of running 1.5 miles and then timing that. And you do some calculations and they're pretty decent for the most part. I mean, these things are directional more than anything. The biggest driver of VO2 max is your cardiac output by far. Like, if you just take the number, what is going to be the major driver there? How well is your heart pumping blood to the rest of your body? There, like we mentioned, it is a great measure also of your mitochondria and your blood vessels and your respiratory function, etc. But, when you go get these tests, they're typically about 20 minutes long. You're warming up for 3-4 minutes. The full test is usually somewhere around 14 to 17 minutes. You continue to push, and if you're on a treadmill, they kind of increase the incline. You've got the mask on, so it's a little uncomfortable, but you're pushing. Last 3 and 4 minutes are uncomfortable. Like, you're huffing and puffing into a mask that you're not comfortable with while you're trying to psychologically push yourself to get to the absolute limit. And, you have doctors and technicians and everything next to you, making sure your heart's okay and you're not going to pass out or anything. So it's you have to do it in a monitored setting. But once you get that result, we can do a lot with that. I often talk about this hazard ratio for those that understand what that means. But if you have a lifelong smoker and you have a your all-cause mortality over the next year is about 40% higher than a non-smoker. If you have a low VO2 max versus a high VO2 max, your all-cause mortality in the next year is 400%. So you have a 10 times higher risk than being a smoker by having a low VO2 max. So what is a good VO2 max? It's a gradient. It's definitely normalized by sex and age. If you're a 40-year-old man, a VO2 max of 40 is decent. At any age, a VO2 max north of 50 is pretty good. I think the highest ever is something like in the 90s, and you'll see all sorts of reports and everything there. One of our friends and colleagues, Eric Hinman, who's a well-known athlete, he was telling me his VO2 max is in the 60s. It's hard. Like, that is a elite level performance. So for
Yeah, that
most
dude
of our,
can crank too. So
yeah, I mean, most of our patients, we want them to be in the 75th percentile or higher of VO2 max. And what that actually means, what we're trying to track back to, is you're going to lose about 10% of your VO2 max per decade, even if you're staying relatively active. And so think about where you want to be at 80. If your VO2 max is 20, you will have a hard time walking up one flight of stairs or, walking down the jetway to your airplane, right? Like, if those are things you want to do when you're 80 and not be winded, you got to kind of reverse engineer and think about, okay, well, where does my VO2 max need to be right now? I'd say for most 40-year-olds, you want your VO2 max to be north of 40 in order to give yourself enough reserve to be functional in those later years of life. If you're above 50, you're doing a great job and you're in the top 5th percentile or so.
awesome. Yeah. So you think if you measure a VO2 max, get a VO2 max back, you go get the lab test done, you get your number, is that the best marker we have at this point for longevity? Or is there something else out there that, you think is better? Or what's your take on that?
It's hard to know what is the one singular best marker for longevity. I think if I had to choose one, that would probably be up there, even more than ApoB or insulin resistance, ALMI, which is appendicular lean mass index, which is a measure of just muscle mass, and sarcopenia. That would be up there. If I had to choose one, it's probably VO2 max. If I had to choose 4 or 5, it'd probably be some combination of those.
Yeah, I agree. I think it's tough to fake, well, it's impossible to fake a good VO2 max. You got to be in shape. Like, you got to train it. Like, your body has to be healthy. And do you think people chase a VO2 max too much? They chase it. They try to essentially, they're trade-offs. They're missing out on strength training because they're trying to get their VO2 max boosted up and they're losing out.
Potentially, but I'd say there are a few things that track linearly with longevity and with mortality and with outcomes as strongly as VO2 max does, to the point where you can get to a point where muscle mass is correlated with lower life expectancy, right? At a certain point, you sort of peak and then it starts becoming detrimental. That doesn't seem to be the case with VO2 max. There's no like upper limit of VO2 max that it starts to turn around and become detrimental. So I think people are chasing clout in all sorts of things, right? And I think there's a lot of inaccurate ways of measuring this. There's all sorts of tools out there now that have no validation whatsoever. You'll see these influencers get out and be like, my VO2 max 80. It's like, really? Like, you're like literally the top 5 person in the world. Like, are you sure?
Let's see the numbers. Numbers.
Yeah, and like, let's go do that in a lab under a monitored setting, right? And like actually get a sense. Do I ultimately all of us get better because we're trying to prove to one another that our VO2 max and our cardiovascular respiratory fitness is super strong? And great. I think society and our population are going to be much better off for it. So Brock, this has been a great conversation, my man. Thank you. I think all of us could benefit from more high intensity work in our lives. Sprinting is one of those things, whether you do it on the track, whether you're doing it on the bike, whether you're doing it in the pool. There's a lot of ways to kind of get your heart rate there. There's so many benefits, from driving up VO2 max to hypertrophy to psychological impacts and everything in between. Something that we definitely recommend adding to our regimens. And we hope you learned something here today. Until next time, we'll talk to you again on The Ultimate Asset.
Thank you for listening to The Ultimate Asset. Until next time, keep investing in your greatest asset, yourself.
This podcast is for informational purposes only and does not constitute professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or before making any changes to your health regimen. Never disregard professional medical advice or delay seeking it because of something you've heard on this podcast. Reliance on any information provided in this podcast is solely at your own discretion.